This is Valley Fever Voices, and I'm Dr. Pamela Dragos, and we're going to talk about when to stop fluconazole based on your dog's titer today. So, the reason I thought about this is because I learned a whole lot at the 69th annual coccidioidomycosis case study meeting with a bunch of human researchers. Three vets, I think, were there with me, mostly physicians and researchers in the human field. And then if you watched the podcast last week with Dr. Jared Jaffe, he went over when to stop fluconazole based on the titer. And basically, he was saying that we stop treating with antifungal drugs when the titer becomes low, not negative, but low and consistent. So it's not rising. It stays low and it stays either the same or gets, or it improves, like it goes towards negative. And the dog does not have any symptoms, and they feel it's safe to discontinue the fluconazole at that point. And that's pretty much what they do in human medicine. So that's what I learned at the 69th annual meeting with all the researchers and physicians is they get people down to a valley fever titer of about 1 to 8 or less, and then they discontinue the antifungal medication, assuming they don't have any symptoms, and then they wait and see what happens. So basically, they're hoping that they're in remission, their immune system is healthy enough to get rid of the valley fever or keep it in remission. But some of the people, I think they said about 10 or 20%, will relapse because the valley fever is just kind of smoldering there. It's not all the way gone. And if their immune system isn't great, then it just relapses and comes back. And sometimes you can't tell if it's a relapse or a new infection. But usually when you're not getting a titer to negative, it's more likely a relapse. And that's the same thing that happens in dogs. We treat dogs with the antifungal medications for valley fever. We get them down to a low titer, and as veterinarians, we like to treat conventionally with the antifungal drugs for about 9 to 12 months for a simple valley fever infection, and longer if it's in the bones or the central nervous system. But after 9 to 12 months, if the dog does not have any symptoms and the titer is fairly low, meaning 1 to 8 or less, the veterinarian will discontinue the fluconazole or the other antifungal and see what happens. And most of them do fine, but some of them do relapse. So the reason that this came to mind is I literally had 2 patients this week relapse after discontinuing fluconazole or discontinuing an herbal formula for valley fever. So I have 2 patients that once they stopped the fluconazole, all the symptoms came right back within 2 weeks. And one of them did not test at all. So they treated for about 6 months and then took the pet off the medication without doing the titer. And then 2 weeks later, the joint swelled up and he felt lousy again. And then another patient was on fluconazole for 6 months. The titer got down to, I believe, 1 to 4, and the veterinarian took the dog off medication. And the dog then developed neck pain and muscle twitching and lethargy and just feeling lousy and painful. So he likely relapsed. So I sent both of them to go get a titer, a valley fever titer, kind of to see where they're at and start again. So my spin on this situation where we treat with the antifungals, we get the dog to a low titer. They have no symptoms or signs of valley fever, and the titer kind of stays the same, for a few blood draws. And we take them off the medication. And that's not necessarily what I've been doing. What I've been doing is I treat until they're negative. But I think it's reasonable, and I learned a lot from Dr. Jaffe. I think it's very reasonable to get them down to a low titer, 1 to 8 or less, and if they have no symptoms, to take them off the antifungals. And I think the rationale for that may be that the antifungals cause a lot of side effects. They affect the liver, they can affect the kidneys, they affect the appetite. A lot of my patients can't be on fluconazole because they have side effects, like they lose all their hair, or they get rashes all over their body, or worse. So taking them off the antifungal pharmaceuticals as soon as you can is actually pretty logical, because the pharmaceuticals have a lot of side effects, both short-term and long-term, that we don't want to get into. The problem I have with that is, if we're going to do that, I still want to support the immune system. And so the way I treat valley fever is integratively. So I do the conventional antifungal pharmaceuticals because valley fever is freaking serious. It can be fatal. It can be deadly. I've had 2 of my own dogs die of valley fever. I've had a lot of patients die of valley fever. It happens, and it's horrible. So I take it very seriously. So I do the antifungal pharmaceuticals, but I also treat on the holistic side, and I support the immune system. And I find when I do both of these things, my patients get better faster, and they don't need to be on the fluconazole as long. Actually, their treatment time is pretty much cut in half, which is fabulous. So they don't have to be on those antifungals. And I can get them to negative faster than if I just had them on the pharmaceuticals. So the foundation of health and the foundation of the immune system is in the gut. So the gut provides 70 to 85% of our immune system. So it's really important to support the gut. And that means being on a good diet. And a good diet means a real food diet or an anti-inflammatory diet. So holistically, I put my patients on a real food diet, which supports their gut and supports their immune system and is the foundation of health. And then I avoid a lot of toxins. And toxins can be things like vaccines, detergents and air fresheners and fragrance candles in the environment, pharmaceuticals. I see a lot of my patients that have other problems like allergies because they have inflammatory problems, and they're placed on Cytopoint, which then suppresses the immune system. So there are a lot of things that can affect the immune system. And so I don't want to do that. I don't want to add any extra toxins to the body if I can get away with it. And then I do natural supplements that support the immune system. I do herbal supplements that are antifungal, anti-inflammatory, analgesic, cough suppressant, antioxidant. So I'll do herbal supplements. I'll do mushroom supplements, which are immune modulatory. Mushrooms not only help with the immune suppression, but some of these dogs also have allergies, which is considered a heightened immune system. So basically, they've got a heightened immune system and a suppressed immune system, and we call that in holistic medicine a deranged immune system. And mushrooms will help get the pet's immune system modulated or in the middle where it's supposed to be. Not too high, not too low. So they modulate. They're very, very safe and effective. And I always use them with valley fever. They're a great core supplement. Other core supplements I use for the immune system would be things like fish oil. Fish oil is very anti-inflammatory, great for the immune system. And the other supplements I would use would be based on the dog's symptoms. So one of the dogs I saw that relapsed also had allergies, and he was the one that was on Cytopoint and all these flea and tick medications, which I avoid because they're very toxic to the system. But I put him on an herbal formula that not only helped with valley fever fungal infection, but it helped with the inflammation and the skin infections he was getting from the allergies. And honestly, when I see a dog with valley fever and allergies, I think leaky gut, because basically leaky gut is the underlying cause of inflammatory conditions and the root cause of things like allergies and valley fever. So you have to address that issue too. So he also got supplements for leaky gut, things like glutamine, colostrum, bone broth. So as a holistic vet, I address the whole dog, not just the valley fever. I don't just do like fluconazole to take care of the valley fever, which is the conventional route, which is fine. We need that. But I also look at the whole dog and support the immune system. And the other dog that I saw was a young dog, 2 years old, that had valley fever in the past and was he got to a low titer and was discontinued. He discontinued off the fluconazole because he was acting fine, and it relapsed. And that dog I did not see until he had relapsed. So I didn't have any input on what had happened previously. And that 2-year-old dog was on kibble food, was getting routine vaccines despite the valley fever, and was on nothing but the fluconazole. And then he showed up in pain and was placed on gabapentin, carprofen, and methocarbamol for the neck pain. So his immune system was not being supported, and it was actually being suppressed. So that dog, we definitely want to get a test done to see what the titer is, get him back on fluconazole, assuming that it's the valley fever that's relapsed, and also support the immune system. So change him from the kibble food to the fresh food diet, add some immune modulating mushrooms, add some fish oil, add a valley fever tincture. I have a custom valley fever tincture called Canine Valley Fever Support at valleyfeverpotion.com. So I recommended that, and then a supplement for pain. And you can either go an herbal supplement for pain, or maybe like a homeopathic supplement for pain. But I try not to use the pharmaceuticals like Rimadyl or carprofen and gabapentin, because then they suppress the immune system further. And I find that these guys really need to have their immune system bolstered in order for them to get over the valley fever quickly. And when I try to avoid, or holistic vets try to avoid pharmaceuticals and use natural supplements instead that don't suppress the immune system. When we do that, the fluconazole works quicker, and we can get them off the fluconazole quicker. So I totally agree that getting a dog to a low titer with no symptoms and pulling them off the antifungal pharmaceuticals is totally rational and good because of the side effects we see with the antifungal drugs. But my approach is to continue the holistic strategies until they're negative titer. And when I add holistic strategies right away, so when I first see a valley fever patient and put them on an antifungal drug like fluconazole, I'm also doing the mushroom supplements, the herbal supplements, the homeopathic pain medications, the foundational fresh food diet. I'm doing all that at the same time. And so I can get them to a negative titer a lot faster than if I use just fluconazole. And that way I can get them better faster and pull them off the fluconazole and have them negative, which I really like. So that's the benefit of using an integrative approach. And an integrative approach means you do both the conventional pharmaceuticals and you do the holistic natural strategies. And the natural strategies are research baked, research backed. There's research on all the herbs on PubMed, and they've been used for centuries or longer. So there's historical data, but there's also research data now on the herbs and supplements and nutraceuticals. So there's research to prove that these herbs are antifungal or anti-inflammatory or whatever we're using them for. And when we combine them in different formulas, we get an even better response because there's synergy with the herbal medications. So I use an integrative approach and help these dogs with valley fever faster so they can get off the pharmaceuticals, which is conventionally what vets and physicians want, to get their patients off the antifungals quickly. But we also want to help our patients recover completely. So I actually did this for myself because I had valley fever twice. And the first time I had valley fever, I was young and in college. And I think I was just placed on, ketoconazole at the time, because I think that's all we had. It was 40 years ago. I think I was placed on ketoconazole for like 10 days, maybe just a few weeks. And I was fine because my immune system was probably a lot better when I was young. But then I got valley fever again, and it really took me down. And I treated myself holistically, but I was on fluconazole and actually itraconazole because it went to my joints. But I was also doing natural strategies, and that's important for people. I mean, granted, I'm a veterinarian, so I'm making recommendations for dogs and cats. But the same thing applies to people. So if we're on a junk food diet, we've got leaky gut and our immune system sucks. So a foundational healthy diet, for example, a Mediterranean diet, is a lot healthier than eating out at McDonald's all the time and eating Cheetos and donuts and drinking pop. And actually, Dr. Jaffe alluded to that last week because he did a study in dogs, comparing dogs on kibble and dogs on a fresh food diet, and looking at cellular parameters. And he actually proved that the dogs on the fresh food diets had less inflammatory markers than the dogs on the kibble foods. So there's research on food. There you go. So same thing with people. If you're on a foundational good diet, you're going to be a lot healthier, and your immune system is going to be healthier, so you can kick the valley fever faster and better. And then I also took my valley fever tincture, which is an herbal tincture. I took mushrooms, and I took zinc and vitamin D because I was low in vitamin D. And that's actually a test you can do on dogs. You can check their vitamin D levels, and if they're low, you can supplement vitamin D, but you want to test first. And then fish oil I was on. So I was supporting my body based on my symptoms and my blood work because I was low in vitamin D. And I was supporting my immune system. So I thought I had a pretty healthy diet, but apparently not healthy enough to not get valley fever. But I think I got a big blast of valley fever, and it overwhelmed my immune system. But so all the stuff I was talking about with dogs applies to people. So people that get valley fever need to support their immune system. They need to think about how they eat, how they what they supplement themselves with, and support their body's functions. And with people and dogs, we also want to think about exercise and activity and not being bored or not being too busy. In people, we have the emotional component. So we do like Qigong and yoga and stuff, and meditation for the emotional component so we can reduce our stress. In dogs, I find that we definitely want to give them a low stress environment, and not have a lot of craziness going on, and have a nice routine, and give them the exercise they can tolerate, and make sure they're not bored. So there are things that you can do physically to help with your immune system, so that helps you get over valley fever. So I started doing more meditation, more yoga, and when I was feeling better, I was lifting weights. So we need to take care of ourselves. And actually, when I got sick, I also cut back on my work because that was causing a lot of stress. So that was something I had to do in order to get better, is to stop working so hard. And I don't think we make our dogs work so hard, or too hard. But they do need routine and less stress and things to do, whether it's chewing on a bone or a puzzle toy or watching doggy TV, and to get out in the fresh air every now and then, and just get out and look at new things and keep life interesting. So bottom line is, we want to support the immune system, and that is something that I am adamant about for people and pets. And I think, and I know, based on my clinical experience, that supporting the immune system improves the recovery from valley fever. So when the titer gets low and consistent and there's no clinical signs, we can take the pet, and that's what they do with people, take them off the antifungal drugs. But I think it's important to keep up that immune support so that we don't have a relapse. All right. Don't forget to check out my my canine valley fever support tincture for dogs at valleyfeverpotion.com. And on my website, drpameladragos.com, I do have a valley fever tab that you can look at my valley fever information. And I have a valley fever store that has the mushroom supplements and the other supplements in there. So thank you again.